It's time to go on the record with WRAL News.
After more than a decade of debate, North Carolina lawmakers announced something remarkable this week. They have a deal on Medicaid expansion. Good evening, I'm Travis Fain. Expansion means taxpayer-funded health coverage for hundreds of thousands of people, many of whom have jobs but can't afford coverage. It means billions of dollars from newly insured customers for hospitals, including rural hospitals, that are struggling to stay open. And it means the realization of one of Democratic Governor Roy Cooper's top priorities after 6 years in office. And it was delivered by Republicans. That political victory will probably come with some strings. We'll get into that later. We have a panel that includes the two Republican lawmakers who probably did the most persuading over the years to get this done, Donnie Lambeth and Kevin Corbin. We have Steve Lawler, head of the State Hospital Association, and we have North Carolina Health Secretary Cody Kinsley. Mr. Secretary, I want to start with you. I want to ask why you feel Medicaid expansion is needed when we already have more than 2 million people, many of them children, on Medicaid in North Carolina. Tell us briefly, please, what North Carolina's eligibility rules are now and why you support expanding beyond those rules.
You know, we still have 1.2 million people in North Carolina that don't have health insurance. That means they have no way to pay for the preventative care that they need to stay out of the places where it's often very expensive to get care, like the emergency department. As a kid who grew up in North Carolina without health insurance, this is a big step forward. This is a big step forward for families, and I am thrilled for it. It's going to make a difference. It's going to allow us to continue our path of moving more towards value, saving money over the long run. This is a smart investment for North Carolina. And
the rules now, they're pretty strict in North Carolina, right?
They are, and this will move them to 133% above poverty line, roughly $30,000 for a family of four. What we know is that most folks that are uninsured in North Carolina are working. They're working many jobs, but they're stuck in that spot where they make a bit more than the current eligibility rules, but not enough to afford health insurance on their own. We want to make it affordable for them. This helps.
Yeah, that's the healthcare gap we talk about quite often. Senator Corbin, I want to come to you. You represent the far western part of the state, and you were one of the earlier adopters among Republicans on expansion. I want you please to tell us what you were seeing in your district, your very Republican district, that convinced you on this.
That's a great question. So early on, I'll have to give credit where credit's due. One of my small counties, I've got 8 counties right now as a senator, but Graham County touches Tennessee. It's in the very western part of my district. Graham County came to me with a resolution signed by all their members. That charge was led by their commissioner chair, Dale Wiggins, and they gave me a resolution supporting Medicaid expansion. And then my other counties followed suit. And I think all but one did that. The other one didn't say they weren't for it. They just didn't give me the resolution. But I got support from all my counties, all Republican counties, and all majority Republican county commissioners that gave me the thumbs up to support this. So it gave me a really nice early start to support this. And I was actually still in the House, Donnie, when that happened. And so way back then, I was actually on, I believe it was House Bill 655 that Lambeth authored. And so, yeah, it was pretty early on for me.
And was it just the reality of life, and much of your district is pretty rural, with hospital closings or the fear of hospital closings that led people to support this?
I think all the above. We've had hospital mergers. Erlanger, which is in Murphy, the very far western part of my district, was Murphy Medical Center was bought by Erlanger out of Chattanooga. The hospital in Franklin was bought by Mission and now HCA. So there's been a real fear that small hospitals would close, and this money is going to mean a lot to my rural hospitals. Secondly, we have a fairly high percentage of our population that's going to be added to the rolls that don't currently qualify for a tax credit. And that's in my other life, that's what I do for a living. I'm sitting in my insurance office and we do health insurance. And Secretary Kinsley referred to this chart. And this was a chart that we used for this past year for 2022, for 2023 enrollments. And as he said, a family of four, about $28,000. If you make less than that, you do not qualify for a tax credit. So that family has to walk out of here with no insurance or a premium of maybe over $1,000 a month, which they clearly could not afford. So they would go uninsured.
Now, I want to talk about, in addition to the money, something that's paired with this bill, and I'm going to come to Representative Lambeth on this, is a rollback in a bunch of hospital regulations that limit competition in this state. They keep hospitals from expanding, particularly when it comes to profitable services, without state approval. These rules are called Certificate of Need laws, or CON, and hospitals really push back hard against the repeal of these rules, and it's a partial repeal in the bill, the Medicaid expansion bill, as proposed. Representative Lambeth, you're a former hospital executive. How much will the CON reforms in this proposal boost competition in the healthcare sector?
I think it will boost it some, but we've needed to reform the CON laws for a number of years now. We've been having that discussion. It seems like for at least 4 or 5 years. It always comes up as part of our budget negotiations with the Senate, and we've had that discussion with the healthcare folks to say, look, it's time that we do some meaningful reform. And we went to them and said, hey, help us figure out where is there a good compromise here that will enable us to move forward and do some reform that will enable us to move forward on some of the healthcare policies that we really had more of a significant impact on North Carolina. I think the healthcare market has changed. CON, 20 years ago was different than it is now. Many hospitals have grown. There are very few independent hospitals left. There are very few independent physician practices left. And I think working together with the healthcare organizations, we were able to come up with, I think, a sort of a sweet spot there that we all could agree on. There was something that needed to be done in terms of reform.
Under the proposal, though, a lot of those reforms don't take effect for 2 or 3 years down the road. Obviously, future General Assemblies will meet between now and then. I mean, is it a guarantee that these changes actually take place, Representative Lambeth?
Yeah, there's never any guarantees. We are always free to change things going forward with a new General Assembly. But I think there is a commitment by all that's been involved in this that we do go ahead and give the industry a chance to adjust. And that was one of the things we heard. Give us some time to adjust to new regulations, and then we can move forward from there. And that's sort of the plan of how we're going to actually implement these over a period of years.
All right, Mr. Lawler. One of the things hospitals have always said is that they have to charge paying patients more to make up for uninsured patients who show up at the emergency room, for example, who can't pay. With Medicaid expansion providing health insurance for so much of that population, are hospital charges for paying patients definitely going to go down?
So I would say that, under the future law, the Medicaid expansion, what it's going to do first and foremost is to, give those nearly 600,000 people, access to care at a time in their lives where they're able to, go to the physician and address, chronic issues at a time where it's not, an acute care visit or an admission within the hospital. So it is an opportunity for hospitals to actually receive some reimbursement for those people that they've been caring for all along. It's just at a better time, at a better place, and at a better location, amongst their healthcare journey. So because, we expect to see bad debt go down, I mean, there's certainly opportunities for hospitals to work within their community to continue to make the cost of healthcare lower and make it more affordable.
So I heard opportunity. I did not hear a promise there. North Carolina is the 11th most expensive state in the nation for outpatient care right now, according to a RAND Corporation report. Can I get a promise that prices will go down?
Well, I can assure you that every hospital in North Carolina is working to reduce the cost of care. So that is a fact.
But these billions of dollars being pumped into the system certainly should help on that.
Oh, yeah. So I would say that, the past 3 years for North Carolina hospitals have probably been the most difficult in the history of healthcare in North Carolina. So hospitals have led the state through a pandemic. We've dealt with economic pressures that have not been seen before. So we're grateful for this bill, and we're grateful for the opportunity for those North Carolinians that haven't had coverage to receive coverage. And we're grateful that the HAS payment is going to help shore up North Carolina's safety net so that they are there not only today, but also well into the future.
All right, we'll talk about the HAS payments when we come back. We're going to pause for now. And when we come back, more on this blockbuster legislation announcement. Stay tuned. Welcome back. We're talking Medicaid expansion, which is moving forward in North Carolina after years where it looked like a pipe dream for supporters. 1 year ago, I could have had top Republican leaders on this show to speak in opposition, but with GOP lawmakers embracing the idea, that point of view is harder to come by. I do, though, want to highlight this statement from the John Locke Foundation, a conservative think tank that remains against the proposal. They said, in part, in what can only be deemed as the largest expansion of entitlements in state history, the Republican majority legislature has decided to saddle North Carolina taxpayers with significant financial burdens and drive up healthcare wait times for our state's neediest and most vulnerable citizens. The failure to meaningfully address supply-side problems will only exacerbate statewide healthcare shortages and drive up wait times and costs for the general public. Representative Lambeth, I want to deal first with the supply side criticism, the criticism that there simply won't be enough health care for all these new patients. Basically, the foundation is voicing a concern from a number of policymakers, stated by a number of people, that there aren't enough doctors and nurses and facilities to serve this population as they get insurance cards. What do you say to that?
I'll say two things. One is we're taking care of a lot of these patients already, and these people already. We take care of them in our emergency room, which is the worst place to take care of these patients. We need to get them out of the emergency room, get them into a better primary care setting, continue to look at areas where we can address some of the workforce needs, continue to allow PAs to practice to their full extent of the law, continue to use telemedicine in rural areas. There's a lot of things we can continue to do. And we're also working on a jobs development or training bill that I hope that we can get introduced this session that will enable us to expand some of the community college programs so that we can get more kids into allied health fields. No question it's an issue, but we're prepared to deal with that issue. Yeah, the big point is we're already taking care of a lot of these patients in our emergency rooms.
I think you bring up the pipeline issue, which is a good one to bring up, that there are not enough people being trained, particularly, I believe, as nurses to serve the future population. Steve Lawler, I want to move to you with the North Carolina Healthcare Association. Yes or no, if you can, is this going to increase wait times to see doctors or specialists, or will it do the opposite?
No, I think it'll do the opposite. I think when people are receiving care at the right place, at the right location, at the right time, they're generally healthier, and they have a greater opportunity to help manage their health themselves. It should reduce wait times in emergency departments, which has always been, a major issue, not only for hospitals and health systems, but also for patients. And as Representative Lambeth said, when these individuals have an opportunity to access care in a different setting and not in the most expensive setting, which is the emergency department, it should, actually free up capacity within hospitals to take care of those individuals who really need to be there.
All right, I want to highlight one other statement against expansion, and Secretary Kinsley, I'll come to you on response to this. It's from Americans for Prosperity, which pushes for tax cuts and regulatory rollbacks. Quote, the Biden-Cooper agenda to expand a broken government health program means that North Carolinians will have to settle for the status quo. Studies have shown little benefit to other states that expanded Medicaid, but longer wait times for medical services, budget-busting cost increases, and no difference in healthcare outcomes. Secretary Kinsley, what do you say to this argument that studies in other states don't show benefits from expanding Medicaid?
Unfortunately, that's just not true. Quite to the contrary. There are consistent studies across the country. We have been able to watch states move forward with expansion, first and foremost with impacts to rural health. We've had over 10 hospitals close over the last decade in rural communities here in North Carolina. It is consistent that in states that have expanded Medicaid, those rural hospitals are able to function and to stay in business. There's a number of other factors around health quality, infant mortality in states that have expanded Medicaid. By having access to care, the difference makes sense. So, and I also want to applaud the General Assembly. We've been on a path to modernizing how our Medicaid system works, to stabilize it. We're still on that journey towards investing more in value. Our Medicaid program in North Carolina is strong and reliable, and a smart investment in people's lives, and a healthy group of folks make a healthy workforce and a healthy economy. So this is the right investment.
All right, sticking with you, Mr. Secretary, I want to get a little detailed about the plan plan. In addition to expansion, there's an extra $1.8 billion in the proposal for hospitals. It's a stabilization fund funded by the federal government called HASP. It's money meant to help these hospitals. But I want to understand how it works. So if you could kind of quickly explain what HASP is, how it dovetails with Medicaid expansion, and clarify for me, because I've heard yes, I've heard no, whether or not it would raise Medicaid reimbursement rates in this bill.
So HASP takes advantage of a federal government program called Directed Payments that is designed to shore up provider networks throughout the state. This program will put direct checks, in this case to our hospitals, to support them. And going forward, we estimate that to be around $3.7 billion a year to shore up the safety net, to try to offset the costs like increased workforce costs and other things. And it's based on the number of Medicaid patients that people see. So it's an indirect increase in Medicaid reimbursement rate, but that's how it's designed. But the timing really matters here. You know, if we can expand soon and get the timing right, we'll not only be able to get that go forward for HASP, we'll also be able to get retroactive payments for HASP back to the start of this current fiscal year. And that's the $1.8 billion that's sort of on top of the go forward. And that's why, you know, we want to get the timing right of this and get moving fast so we can maximize the benefit for North Carolina.
And is the timing of that geared not toward when this bill passes, because it hasn't passed yet, it's just been announced last week, or is it geared toward go live on Medicaid expansion? Because that's going to be delayed for a little while. We'll talk about that in the next segment. But where's the trigger? When do we need to finish this by?
There's two things. It's one, it's when the assessments for HASP start and how it's funding, and it's when the first person enrolls on Medicaid expansion. So we want to get those things done before the end of the fiscal year to get this right. We look forward to working with the General Assembly to get this timing in place so we can maximize the value.
All right, so the bill has to pass. It has to be implemented, which is going to be tied to the state budget, which we'll talk more about. And then we have to actually do enrollment after the feds sign off on some things too. So there's quite a few steps, correct?
That's right.
All right, we're going to take one more break here. And when we come back, I've got another guest to bring in. And we're going to talk about what's not in this bill. Welcome back. We're talking about a deal announced this week to expand Medicaid health insurance in North Carolina, and now we get further into the fine print. The bill, as described, says expansion won't kick in until the state passes a new budget. That means that in order to get Medicaid expansion, this huge priority for Governor Roy Cooper and other Democrats, a budget written by Republican legislators has to become law. That is a lot of leverage. Representative Lambeth, you're a House budget writer. What are Republicans going to make the governor and Democrats accept in this budget to get expansion?
Yeah, I don't think you'll see anything different from what we had in the last budget. We continue to look for ways to make our budget more efficient. So we look for ways to reduce the state budget. We look for ways to send money back to taxpayers. So we're looking at some tax cuts again. We're looking at any area that we think we can be more efficient in. And we're also looking to get this budget done in early June. That is a high priority for us, is to move the process along as quick as we can and get this budget done as early as we can in late May, early June, so that we can get this voted out and have those final discussions with the governor.
On tax cuts, there are already several planned that y'all passed in previous years and are going to roll through the next few years. I understand there's probably going to be a move to accelerate those. Do you think it'll be on the personal income tax side, the business tax side, or both?
Yeah, and you've seen the very good economic news from North Carolina that we recently received. We expect to have a good report at the end of the year. I think right now I would say it's going to be focused primarily around the personal income tax, but I wouldn't rule out a review of trying to move up the corporate tax as well. That's where a lot of our focus is right now, is primarily on the personal income tax. But as we get more information about the economic position of the state, we'll look at both of them.
All right. I want to talk now about what's not in this bill. Last year, Senate Republicans wanted to pass two things with expansion: the CON reforms we've discussed and the SAVE Act, which gives advanced practice nurses, more authority to serve patients without having to have a doctor supervise them. Again, that's called the SAVE Act. This was pitched as a way to serve more patients and to entice more nurses to North Carolina, since doctors charged nurses tens of thousands of dollars for this supervision. 26 other states or so have passed something like this. But this has been jettisoned from the bill after the Senate insisting on it last year. It's gone from the bill. State Senator Gail Adcock joins us now. She is a nurse by trade and a Wake County Democrat. Senator, you've waited patiently. Thank you. What do you think of this deal and the decision to lose the SAVE Act for nurses?
Thanks so much, Travis. Well, two words you used I would not. One is jettison and the other is lose. While the SAVE Act was included in an omnibus bill last year before the session ended, and that was a decision made for that time. This time around, I think as the leadership considered what could help them meet a very tight timeline so that we don't lose the window on HASP and Medicaid expansion, they decided to lighten the load and to take this opportunity to get Medicaid expansion done. I would never interpret that as meaning that the SAVE Act has lost any of its support, particularly from Senator Berger, and that we're just going to find a different opportunity and another path to improve access to care by lifting the some very old, outdated laws and regulations on the practice of advanced practice nurses that limit access to care.
All right, and Senator Berger, the top Republican leader in the Senate, it has been the House where this proposal has been more difficult to get support for, and I wonder what you see as its chances going forward. Senator Ralph Heiss, one of your colleagues in the Senate, a Republican leader on health care, he said that this week that without the SAVE Act, Medicaid expansion would fail in North Carolina because we simply won't have enough nurses to care for people. Do you agree with that? Senator,
so what I would. Oh, okay. I thought you were sending that to Senator Corbin. I think that his statement is correct. But what we have to understand is this is not the only way to achieve that purpose. Tying it to Medicaid expansion directly is not the only way to do it. We can still pass the SAVE Act, just at a different time during this session. And I have every optimism and faith that that's what we're going to consider doing and that it has an opportunity to be passed.
All right, Senator Corbin, I will come to you now. You've worked on expansion for a while here. Quickly, what's it like to see this come to fruition?
When will this come to fruition? I think it's, I really can't say an exact timeline, but I think obviously the House bill is over in the Senate now. What we will do operationally is we will probably run an amendment to that bill. We'll use the House bill and more than likely run an amendment to that bill, which will probably happen in committee, maybe even the committee I chair, which is healthcare. That amendment will be added to that, and it'll go through the rest of the process and then go back to the House for hopeful Representative Lamberth concurrence on your side. I think that will be the process moving forward.
All right, a lot of work, a lot of hard work put in on this already, a lot left to go. That's about all we have time for. I want to thank our panel for being here. Much appreciated. I want to thank you at home for your attention to this important and complex topic. If you have something to say about tonight's discussion, follow us on Twitter, twitter.com/WRAL. Email comments, questions, criticisms, that's on the record at WRAL.com. And you can always write us a letter. That's P.O. Box 12,000 here in Raleigh. Thank you for joining us. Have a pleasant evening.